9. Warning signs in your feet that could mean diabetes. And 5. Top tips you should start today. Your feet are actually the mirrors of your internal health and can reveal hidden dangers like high blood sugar. Diabetes often begins its silent destruction in the furthest parts of your body long before you feel any real pain. Ignoring a simple tingle or a change in skin color could lead to life-altering complications that are completely irreversible. Today, we are uncovering 9 shocking signs in your feet that could mean your blood sugar is dangerously high. Before we dive into these critical warnings, please tell us in the comments where you are watching from today. Also, share your current age so we can provide more tailored health insights for your specific stage of life. Your engagement helps this vital information reach more people who might be at risk of developing serious diabetic issues. Let's start with the first warning sign that most people mistakenly dismiss as just a common sign of aging. Sign number 1. Tingling or pins and needles. A persistent tingling sensation in your toes is often the very first sign of diabetic peripheral nerve damage occurring. High glucose levels in the bloodstream slowly erode the protective coating of the nerves that lead to your feet. You might feel like small insects are crawling under your skin even when you are resting quietly at home. This uncomfortable sensation usually starts in the tips of the toes and gradually moves up toward your delicate ankles. Many people ignore this signal, thinking they have just sat in an awkward position for far too long today. However, chronic tingling is a major red flag that your nerves are struggling to survive in a sugary environment. If you experience this pins and needles feeling every night, it is time to check your fasting glucose. Early detection of nerve distress can prevent the total loss of feeling that often leads to severe foot injuries. Protecting your nervous system starts with recognizing these small electrical misfires before they become a permanent physical disability. Sign number 2. Numbness or loss of feeling. Losing the ability to feel heat, cold, or even a small pebble in your shoe is extremely dangerous. When nerves are severely damaged by diabetes, they stop sending vital pain signals to your brain during an injury. You could walk all day with a sharp blister and never realize your skin is being torn and damaged. This complete lack of sensation is how minor foot problems quickly escalate into life-threatening infections for many diabetic patients. Test your sensitivity by lightly touching the bottom of your feet with a soft feather or a thin string. If you cannot feel the texture or the pressure, your sensory nerves may already be significantly compromised right now. Numbness often leads to an altered walking gait, which puts unnecessary stress on the different bones of your feet. Check your feet every single evening to ensure you have not sustained any hidden cuts during your daily activities. Restoring blood sugar balance is the only way to stop this numbness from spreading further up your lower legs. Sign number 3. Burning sensation at night. A painful burning feeling in the soles of your feet often intensifies when you finally lay down to sleep. This specific type of neuropathic pain is caused by damaged nerves, firing random and incorrect signals to your brain. It can feel like you are walking on hot coals, even though your skin feels cool to the touch. Many patients find that the weight of a simple bed sheet causes an unbearable amount of burning and discomfort. This symptom is a clear indicator that your small nerve fibers are under immense metabolic stress from high glucose. Do not simply soak your feet in cold water because this provides only a very temporary and superficial relief. The root cause is internal inflammation that requires a total change in your daily diet and lifestyle habits immediately. Ignoring this nightly fire can lead to chronic insomnia and a significant decline in your overall mental health state. Consult with a specialist to discuss how to stabilize your blood sugar and calm these overactive and damaged nerves. Sign number 4. Slow healing sores or ulcers. A small scratch on your foot that refuses to heal after a week is a very serious medical concern. Diabetes narrows the arteries and reduces the essential blood flow needed to repair damaged skin and fight off bacteria. Without proper circulation, a simple blister can quickly turn into a deep, dark, and dangerous open foot ulcer. High sugar levels also provide the perfect breeding ground for infections to grow and spread rapidly across your skin. You might notice that a minor cut stays red, swollen, and moist for many days without forming a scab. This lack of healing progress is a direct sign that your body's natural repair mechanisms are completely overwhelmed now. Foot ulcers are the leading cause of hospitalizations for people living with undiagnosed or poorly managed diabetic conditions. You must clean every wound meticulously and seek professional medical care if the skin does not close up quickly. Maintaining healthy blood flow is the key to ensuring your feet can recover from the daily wear and tear. Sign number 5. Changes in skin color. Noticeable changes in the color of your feet, such as turning red, blue, or unnaturally pale, require attention. Poor circulation caused by damaged blood vessels can make your feet look dark or even slightly purple when sitting. If your feet turn very pale when elevated, it may indicate a severe lack of oxygenated blood reaching your toes. Diabetes can also cause the skin to become thin, shiny, and tight as the underlying tissues lose their health. You might see dark, thick patches of skin forming around the ankles, which is a sign of insulin resistance. These color shifts are your body's visual alarm system that the circulatory pipes are becoming clogged and very inefficient. Compare the color of both feet daily to see if one side looks significantly different from the other one. Healthy skin should have a warm, pinkish hue that returns quickly after you press down with your thumb. Any persistent discoloration should be reported to a doctor to rule out peripheral artery disease and other vascular issues. Sign number 6. Cold feet, despite warm weather. Having feet that feel like ice even during a hot summer day is a common sign of poor circulation. When your heart struggles to pump blood to your extremities, your feet are the first to lose their warmth. This coldness is often accompanied by a lack of hair growth on your toes and your lower leg area. While some people naturally have cold hands, constant icy feet in men is often linked to high blood sugar. The tiny capillaries in your feet become brittle and narrow, restricting the warm blood from flowing through the tissues. You might also notice that your toenails become thick, brittle, and grow much slower than they used to before. Don't just wear thicker socks. Instead, focus on improving your heart health and lowering your internal glucose levels. Walking more frequently can help stimulate blood flow, provided you are wearing the correct and most supportive footwear. Persistent coldness is a message that your peripheral vascular system needs immediate support and a much better diet. Sign number 7. Swelling of the feet and ankles. Edema, or swelling, occurs when fluid becomes trapped in the tissues of your feet due to poor kidney function. Diabetes often damages the small filtering units in the kidneys, leading to significant fluid retention in the lower body. You might notice that your socks leave deep, painful indentations in your skin at the end of the day. Swelling can also be a sign of a heart that is struggling to move blood against the force of. When your feet become puffy and tight, it makes it much harder for wounds to heal and nerves to function. Try pressing your finger into the swollen area to see if a temporary dimple remains in the soft skin. This pitting edema is a clear signal that your body is failing to manage its internal fluid and salt. Reducing your salt intake and managing your sugar levels can help your kidneys process and remove excess fluid effectively. Keep your feet elevated when sitting to help the fluid move back toward your heart for proper processing today. Sign number 8. Unusual foot odor. A sudden and foul smell coming from your feet that does not go away after washing is very concerning. This odor can be a sign of a fungal infection or a hidden sore that has started to decay. High sugar in your sweat provides an abundant food source for bacteria and fungi to multiply very rapidly. If you notice a sweet or sickly scent, it could indicate that an infection has reached a serious stage. Diabetes makes you more prone to athlete's foot and other fungal issues that create a persistent, unpleasant smell. Check between your toes for white, peeling skin or any signs of moisture that could hide a brewing infection. Do not just use deodorizing sprays to mask the scent because you might be ignoring a very deep-seated problem. Keeping your feet dry and using moisture-wicking socks is essential for preventing the growth of these harmful microorganisms. An unusual smell is often the first sensory warning of a complication that you cannot yet see with eyes. Sign number 9. Change in foot shape, Charcot foot. A rare but very severe complication of diabetes is a significant change in the actual shape of your foot. This condition, known as Charcot foot, occurs when bones become weak and start to fracture without any pain. Because of nerve damage, you might continue to walk on broken bones, causing the foot to collapse and deform. The bottom of your foot may become rounded, a condition often referred to as rocker bottom foot by medical experts. You might notice your foot becoming very red, hot, and swollen without any obvious injury or any clear. This is a medical emergency that requires you to stop putting weight on the foot immediately to prevent permanent. Charcot foot can lead to severe disability and increases the risk of needing an amputation if not treated quickly. Always wear supportive shoes and never walk barefoot, especially if you have already lost some feeling in your early recognition of heat and swelling in the foot can save the structural integrity of your entire skeletal system. 5. Top tips you need to start today before it's too late. 1. Inspect your feet daily with a mirror. Use a hand mirror every evening to check the soles of your feet for any hidden cuts or blisters. Since you may not feel the pain, your eyes must become the primary guardians of your foot's physical safety. 2. Invest in seamless moisture-wicking socks. Switch to specialized diabetic socks that do not have tight elastic bands or irritating seams that can restrict flow. These fabrics keep your skin dry and prevent the friction that often leads to dangerous blisters and fungal infections. 3. Never walk barefoot, even indoors. Always wear protective slippers or shoes inside your home to prevent accidental stubs or punctures from small household objects. A tiny splinter that you cannot feel can quickly lead to a major infection in a sugar-rich body environment. 4. Moisturize your feet, but skip the toes. Apply a high-quality urea-based cream to your heels and soles to prevent the skin from cracking and bleeding. However, keep the area between your toes completely dry to avoid creating a damp environment where harmful fungi thrive. 5. Trim toenails straight across carefully. Always cut your toenails in a straight line to prevent ingrown nails, which can easily lead to serious infections. If your nails are too thick to cut safely, visit a professional podiatrist who specializes in diabetic foot care. Conclusion: taking care of your feet is a vital part of managing your overall health and preventing long-term diabetic complications. We have explored the 9 warning signs that your body uses to alert you to dangerously high blood sugar. Remember that early detection is your most powerful defense against the silent progression of this very serious metabolic disease. Your journey to a healthier life starts with the small daily habits you choose to practice starting right now. Please subscribe to our channel for more expert advice on how to listen to your body's unique health signals. Share this video with your friends and family because one simple tip could prevent a future of physical pain. Stay active, keep your sugar in check, and always treat your feet with the respect and care they deserve.